Now to a story about an 11-month-old with a rare condition whose health battle is helping change the lives of kids across Australia. Judah Durham and his parents have been forced to travel to Sydney from their regional home so he can receive life-saving treatment. But a new program is now bringing that crucial care to remote areas.
From the moment he was born, doctors knew something wasn't quite right. And every day since, baby Judah has fought for every breath he breathes.
He was transferred from Wagga shortly after he was born, and he was born with a few concerning issues that we noticed, and predominantly around his airway.
Within days, he was diagnosed as one of only about 200 cases of Coffin-Siris syndrome in the entire world. Here in Australia, there are just 8.
There's a really big spectrum for Coffin-Siris syndrome. The children who are affected by it can be anything from severely disabled all the way through to walking and talking and going to mainstream school.
Judah required a tracheostomy to be able to breathe.
Most of the day he's on the respirator. If he's feeling well, we are able to take him off for small amounts of time.
His parents, Kirsten and Jackson, have spent most of Judah's young life in hospital with him in Sydney, leaving their 3 other sons, aged 7, 5 and 3, at home with Kirsten's mum.
We're both from very supportive families who have picked up the pieces. The boys live with my mum.
Which is why clinicians in the regional New South Wales towns of Narrandera and Wagga Wagga, where Judah's family live, have become the first to be trained to treat and care for a tracheostomy, a crucial breathing apparatus for those suffering acute airway conditions. Training to care for these rare cases is now being rolled out across the state.
I think there's an opportunity to model this level of care and seeing how we can expand it. What my focus is how we enable healthcare to be delivered closer to homes.
Without this training, babies like Judah would need to stay in a specialised paediatric care unit, like the ones here at Sydney Children's Hospital, so they can receive 24-hour support for what could be months, even years of their life.
To be home means that we are closer to our family, our little boys. They can be part of everything that we're doing with Judah, and we can also run our business.
Being able to upskill regional areas provides a quality of life for these kids that they were never able to have previously.
Making life that little bit easier and helping more sick kids stay at home. Keziah Dawn for 10 News First.